My name is Nancy Lee. I'm a massage therapist and I've been doing massage for over 10 years. I thought I'd make a video for those you moms out there who would like to learn how to properly massage your child who might be hyper or have ADHD or might just be having a headache. I'm sorry about the volume of my computer, but this is the only way that I have to record this right now. So you're going to want to start with your child in a position where they're on their back. You should have a comfortable chair around. And the first thing you want to do, especially with a child, is establish trust. To do that, you're going to want to start with craniosacral techniques, which are very light, almost non-existent touch. So, place your hands behind the child's occipital region, that's the region right behind their neck. So I'm going to turn Gabriel's head here, and you can see that this region here is called the occipital region. You're going to hold this gently. You're going to ask your child, okay, sweetheart, the only thing I ask is if I do anything that hurts, let me know, otherwise I'm just going to let you relax, okay? So you would hold their head in this position for approximately 3 minutes. Alright, and I'm just going to speed up just for the sake of the video. Next, you're going to place your hands in a position like this. And you're going to do this at the, not the base of the skull, but in the center of the skull. And you're going to want to ask the child just to relax their head and let you do the movement. Alright, so we would have held this. Again, we're going to keep our hands like this, right underneath the middle of their skull. It's almost, if you look at a head split in an anatomical chart, it looks like two beams gone. Alright, after you've held that for 3 minutes, you can gently rub their ears, and this feels really good. You can do this to an adult too. With children, they don't respond to facial massage. I mean, you can do it, but they don't respond as well as an adult might. So next we're going to go to their décolleté or their chest pectoral region. I'm going to place my hands remember, gently. Just relax. I'm going to place my hands gently, okay? And I'm going to push his shoulders down. As you can see, they go down quite a bit. Are you relaxed? He's relaxed. Okay. I'm going to start with gentle compressions. You're going to feel their little rib cage. And you can place your fingers in between their upper intercostals. I have my thumbs behind and underneath where his little traps are, and I'm just doing gentle compression. Then I'm going to put my hands around his little shoulders. Does that feel good?
Yes.
I know, always check in with your child because they might think it's weird. I wouldn't suggest doing oil rub down kids right away because it's a little bit too close in our culture to be doing that. And the purpose of the massage is to relax the child and not to freak them out. So now I'm going to take my hands and I'm going to slide them underneath his little traps. And I'm just going to give a little bit of a squeeze. I'm going to put my hands underneath his occipital region again, and I'm just going to give a little tug, giving him some traction. Right, now I'm going to gently turn his head, and I have his head cupped with my left hand. I'm going to take my right hand and I'm going to make gentle circles. You feel okay?
Yes, I do.
Now remember, these are gentle circles. You're not going to do hard circles like you would on an adult. Very gently. Now I'm going to turn his head. He likes to help. And I'm going to do that same circular movement, starting from the occipital region all the way down to the clavicle. Okay, so I think you probably should do that for a good 3 minutes on either side. Then I'm going to put my hands gently on his forehead to close. Do some gentle compressions on his shoulders again. Alright, and that's about a good 10 minutes. And you'll find that a child is not like an adult where they can lay there for hours and get worked on. Children are going to want to be worked on for approximately 10 to 15 minutes. And then you'll have a relaxed, healthy child.